getting a handle on it the same way. And it made that very relatable. And how that translates to a final product, I think is also important, because one of the signals of a trustworthy system is that it's transparent to an appropriate extent. And if we can help users to understand, what data we are collecting, what data we are using, and make that data on the other side meaningful, then I think we are developing something that's worthy of trust, and it feels that way to the user, because it can be trustworthy as heck, and if people can't grok that, then it doesn't really matter. Right. And I know you've had experiences that you shared that I thought were wonderful in the healthcare space, where you've got clinicians and you have all this data and you're arming them or equipping them, with this kind of at their fingertips. But if in their context, in that point in time, they can't easily take advantage of that, it's not going to be helpful, no matter how good the data is, So that's kind of how I think it all comes together.
Yeah, I think, and that goes back to what you said about transparency, and that was such an essential component of those systems we were building. Because if we're sending off this alert through the paging system and telling doctors to go to the bedside and attend to this patient because they are at risk of clinical deterioration, they need to know what they're looking at, what to look for when they get there. So you can't build a black box model in that environment.